Welcome to TrekFit videos. In this episode, we'll guide you in how to become a Registered Dietitian Nutritionist or RDN and what a career in nutrition and dietetics truly looks like. To become an RDN, you'll need to meet several academic and professional requirements. Starting January 1st, 2024, the minimum educational requirement is a graduate degree from a U.S. regionally accredited university or college. Your coursework must be approved by the Accreditation Council for Education in Nutrition and Dietetics, known as ASCEND, under the Academy of Nutrition and Dietetics. The curriculum typically includes studies in food and nutrition sciences, food service systems management, business, economics, computer science, sociology, biochemistry, physiology, microbiology, anatomy, and chemistry. After completing your academic coursework, you will enter an accredited dietetic internship program. This includes a minimum of 1,200 hours of supervised practice following completion of a didactic program in dietetics and a bachelor's degree. After completing your internship, it's highly recommended to take review courses to prepare for the national credentialing exam. Passing this exam officially earns you the title of Registered Dietitian Nutritionist. The Academy of Nutrition and Dietetics is the governing body of the dietetics professionals. It's the world's largest organization of food and nutrition experts, with over 100,000 credentialed practitioners, including RDNs, dietetics technicians, and students. The Academy is committed to improving public health and advancing the profession through research, education, and advocacy. It plays a key role in shaping food and nutrition policy, offering expert testimony, lobbying Congress, and developing position statements on critical issues. As food and nutrition experts, RDNs translate nutrition science into practical solutions for healthy living. In hospitals and long-term care facilities, RDNs are essential members of the medical team, providing immediate nutrition care to patients. They deliver medical nutrition therapy, targeted interventions to treat chronic conditions and illnesses. Examples include cancer, determining nutritional needs during treatment; in diabetes, managing carbohydrate intake to control blood sugar; in kidney disease, adjusting nutrition for dialysis patients; in liver disease, monitoring protein intake for safe liver function; in heart disease, reducing calories and fat to prevent cardiac events; in tube feedings, calculating nutrient formulas and feeding rates; in complex clinical cases where patients cannot eat or absorb nutrients through their digestive tract, total parenteral nutrition, or TPN, becomes a life-saving intervention. RDNs play a vital role in the interdisciplinary TPN team, working alongside physicians, pharmacists, and nurses to ensure safe and effective nutritional support. Their responsibilities include assessing nutritional needs based on diagnosis, lab values, and clinical status, designing individual TPN formulas that include precise amounts of carbohydrates, proteins, fats, electrolytes, vitamins, and trace elements, monitoring patients' response to therapy, including blood glucose, liver and kidney functions, and signs of refeeding syndrome, adjusting TPN prescriptions as the patient's condition evolves, educating patients and families about the purpose and risks of TPN when appropriate. RDNs ensure that TPN supports healing, prevents malnutrition, and maintains metabolic balance, especially in critical care, surgical recovery, and gastrointestinal disorders. RDNs may also earn board certifications such as Certified Diabetes Educator, Certified Nutrition Support Clinicians, or CNSC, in other specialties. RDNs also oversee food service operations in hospitals and other institutions. They write and approve menus and recipes, ensuring meals meet nutritional standards and patient needs. Majority of their responsibilities include the following: menu planning and nutritional oversight, which include developing and approving menus that meet nutritional guidelines and therapeutic diet needs of their patients, ensuring meals aligned with cultural preferences, age groups, and medical conditions, adapt recipes for calorie, sodium, fat, and allergic reactions, recipe standardization and nutrient analysis, creating standardized recipes for consistency and quality control, use software or manual calculations to analyze nutrient content in food, ensuring compliance with regulatory standards such as the United States Department of Agriculture, USDA, or other governing institutions. Food safety and sanitation. They implement and monitor food safety protocols such as the Hazard Analysis and Critical Control Points, or HACCP. HACCP is a globally recognized food safety management system used to identify, evaluate, and control hazards throughout the food production and handling. Train staff on proper handling, storage, and sanitation procedures. Conduct regular audits and inspections to maintain compliance. In procurement and inventory management, they oversee purchasing of food and supplies based on budget and nutritional goals, evaluate vendors for quality, cost, and sustainability, manage inventory to reduce waste and ensure timely availability. In staff and training supervision, they train food service staff on portion control, therapeutic diets, and customer service. They supervise dietetic technicians, kitchen managers, and support staff, promote teamwork and continuous improvement. In budgeting and cost control, they develop and manage food service budget, analyze cost effectiveness of menu items and operations, implement strategies to reduce food waste and optimize resources. For regulatory compliance, they ensure operations meet local, state, and federal regulations. They prepare for inspections and accreditation reviews by the Joint Commission on Accreditation of Healthcare Organizations, or GCAHO. They maintain documentations for audits and reports. In technology and system integrations, they use electronic health records and food service software for tracking and planning. They integrate nutrition data with patient care systems, monitoring trends and innovations in food service technology. RDNs in food service are not just behind the scenes. They are strategic leaders who balance nutrition science, operational efficiency, and public health impact. RDNs in preventive healthcare clinics responding to physicians' consults. And this is what I have been doing after 2 decades of serving in the hospital settings. In outpatient and community settings, we focus on health promotion, disease prevention, and wellness. We often serve as nutrition consultants, helping individuals and families to make informed dietary choices. In preventive care settings, we serve as essential partners in managing chronic conditions and promoting long-term wellness. When physicians identify patients at risk for conditions like diabetes, hypertension, obesity, or high cholesterol, doctors refer them to RDNs for medical nutrition therapy. RDNs respond to these consults by reviewing the physician's diagnosis and lab results, conducting a comprehensive nutrition assessment, including dietary habits, lifestyle factors, and readiness for change, creating individualized nutrition care plans tailored to the patient's medical conditions, goals, and preferences, providing education and counseling on behavior change, meal planning, and nutrient management, monitoring progress and communicating updates back to the referring provider. These consults often address conditions such as type 2 diabetes that requires carbohydrate counting, glycemic control strategies, in hypertension, sodium reduction, DASH diet education, in hyperlipidemia, fat quality, fiber intake, and heart healthy eating, in obesity, calorie balance, mindful eating, and physical activity integration. By collaborating with physicians, RDNs help patients take actionable steps toward better health, reducing reliance on medication, improving outcomes, and enhancing quality of life. RDNs work in a wide range of settings, including private and government hospitals, healthcare facilities, and private practice. In government hospitals, such as the Department of Veterans Affairs or any of the Department of Defense healthcare agencies. As RDNs gain experience, they can pursue advanced degrees such as PhD in biochemistry or PhD in nutrition. Career paths include clinical care management, food service management, critical care, and specialty units like pediatrics, oncology, surgery, and nephrology. To maintain credentials, RDNs must complete continuing professional education units known as CPEUs. This includes attending approved training, seminars, and workshops through the Commission on Dietetic Registration. In today's complex healthcare landscape, registered dietitian nutritionists are more than just nutrition experts. They are essential partners in promoting health, preventing diseases, and improving quality of life. Whether working in hospitals, outpatient clinics, food service operations, or community programs, RDNs bring evidence-based knowledge, compassion, and precision to every setting they serve. From managing chronic conditions and designing therapeutic diets to overseeing food safety and responding to physicians' consult, RDN's impact is both clinical and personal. As advocates for wellness and leaders in nutrition science, RDNs empower individuals and communities to make informed choices that support lifelong health. RDN's work is not just important, it's indispensable. And as the demand for nutrition expertise continues to grow, so too does the significance of RDN profession.